Assalamualaikum warahmatullahi wabarakatuh. May peace be upon us all. Om Swastiastu, Namo Buddhaya, greeting of virtue. Hello, good morning, good afternoon, and good evening to Mr. Hassan, our classmates from Class C, and to everyone who is watching right now. We warmly welcome you to look at our presentation, and I hope whenever or wherever you are right now, you'll be in excellent condition and be filled with happiness. First of all, let me introduce the member of Group D. Lina Zafira Hanafasya, Loliawakmi Atindria, Lutfia Zahro Istiqlal, Margareta Deborah Eugenia Siagian, Muhammad Aditya Nugroho, Nikomang Regina Arisyanti, Oktaviani Ramalia. People say if you fall in love or if you have a crush on someone, you barely can sleep because everything about him or her is revolving in your head every time. Some even remember the way their crush talks or sounds and replay it in their head. Well, it's kinda true because actually, I've been trying it too. It's what love does to us. But is it true that these behaviors are unrelated to fall in love? Truly, we have a more serious explanation about it because these behaviors such as can't sleep or hardly sleep and listen to people's voice inside your head. In fact, can be somewhat indication to be categorized as mental health problems, called sleep problems and hearing voices. These two mental health problems are going to be the main topics of our group's presentation today. We found this topic very interesting because who knows those small things that usually happen in our daily life can lead to someone problems in our mental health. So, we've been doing some research with a trustworthy and credible research to fulfill our own curiosity and of course to give us some knowledge to make a qualified presentation. We are really excited to deliver the results to all of you guys, and we try to make the explanation as detailed as possible so that you can understand every aspect of each mental health problem clearly. Our main goal by making this presentation is that we want everyone to be aware that mental health is a very important thing to take care of, and we have to be open about it because it really can have a great impact in our life. So, what are we going to discuss today? Because we have two mental health problems to analyze, we will elaborate them in a form of comparison, or to make it more simple. We will explain their similarities and difference in three different main points: symptoms, causes, and treatments. So we will tell the similarities of both mental health problems in terms of symptoms, causes, and treatments. And we will also talk their differences in the same term as similarities. Without further ado, I will give the opportunity to the other members to explain the content. The first one will be Lina, please.
Thank you, Zeta, for your great opening and for the opportunity. So, I will start the explanation of the content by delivering the first subpoint that will be the symptoms of hearing voices and sleep problems. If you look at this, you will see that we have list some symptoms of both mental health problems. The first one, hearing voices, has some symptoms such as 1. Hearing voices as you fall asleep or when you wake up. When you have this symptom, you might also see strange things or misinterpret things you can see. 2. Lack of sleep. Sleep problems cause you to hear voices or have other sensory experience that you can't explain in everyday ways. 3. Hunger or feeling hungry. You may hear voices if you are very hungry or if you haven't eaten much recently. 4. Physical illness. If you have a high temperature and are delirious, you may hear voices or see and say strange things. And the other one, sleep problems, has some symptoms that hearing voices does. As you can tell by its name, the symptoms are mostly related to sleep, such as the difficulty to start sleeping, frequently waking up at night, and having trouble getting back to sleep, waking up too early, and feeling tired and sleepy the next day. Besides that, it also it also has other symptoms like difficulty remembering or concentrating. Vulnerable physical conditions such as irritability, depressions, or easy mood swings, and feeling dizzy at night or in the morning. That will be the explanation from me. The next slide will be delivered by Rere.
Thank you, Lina, for your fascinating presentation. So, we have heard about each mental health problem symptoms. Now, I'm going to tell you about their similarities and also their differences. Hearing voice and sleep problems have a similarity in which body parts relate to their symptoms. Both symptoms actually have a relation to some parts of our brain. Both of them also have symptoms like calling or talking about something that isn't real, like off sleep, hunger, feel restless, afraid, and uncomfortable. And for the differences, someone who has sleeping problems also experience symptoms of difficulty initiating sleep, frequent awakening at night, difficulty going back to sleep, and waking up too early. Unlike sleep problems, someone who has hearing voice doesn't necessarily experience these symptoms. Okay, my statement will be the end of the first subpoint. Let's now turn to the next subpoint that will be delivered by Lottie.
Okay, thank you, Rere. Because we have heard about the symptoms of both mental health problems, now we will move on to the second subpoint, which is going to be the causes. Actually, both mental health problems had many causes. I will try to list it one by one. According to mind.org.uk, hearing voices has some causes including physical illness. For example, if you have a high temperature and are delirious, you may hear voices or see and say strange things. Using drugs also can be a cause of hearing voices because you may hear or see things after taking recreational drugs or as a side effect of some prescribed drugs. The other causes will be stress or worry, bereavement, abuse or bullying, other traumatic experiences, spiritual experiences, and even another mental health problem. And as you can see in the right table, we also put some causes of sleep problems like stress or worries. This one related to issues like money, housing, or work. The second cause is problems with where we sleep. For example, if you sleep somewhere uncomfortable or when you're easily disturbed, you may have a bad quality of sleep. The rest causes are health conditions relating to sleep, also known as sleep disorders, being a parent or a career, recreational drugs and alcohol, working at night or being a shift worker, current or past trauma, and also mental and physical problems. That's all that I have to say about this section. For the next explanation about the similarities and differences of each causes will be Echa's turn.
Thank you. When you listen to the previous explanation, You may have noticed about the causes that are similar or different to each other, but I will clarify it in case you're not really sure about your speculation. So, for the similarity, hearing voices and sleep problems are both caused by stress or worries, drugs, traumatic experience, and mental or psychical health problems. But they also have difference in some aspect. For example, hearing voices can be caused by morning or spiritual experience, but it really didn't have an impact to become sleep problems. Instead, working at night can be lead to some sleep problems, but it can lead to become hearing voices. That's the end of the second subpoint. Let's move on to the last subpoint. Adit, it's your time, please.
Thank you, Echa. Next slide, please. Okay, so we have come to the last subpoint that will be the treatment that should be done when we have hearing voices or sleep problem. We have so many choices when it's come to mental health treatment. For the first one, I will reveal some treatment that you can use when you want to treat hearing voices. First, you can do talking therapies with professional therapy or counselor. Second, you can undergo psychotherapy with psychotherapists. A psychotherapist may be able to help you to identify why the voices say what they say. Think about what make you hear the voices and find a better way of coping with them and learn to control your voices. Third, you can do CBT or cognitive behavior therapy, which can help you deal with how the voices make you feel and think about yourself without always going into the underlying reason for them. It also can help you to reduce your anxiety about the voices, help you stand up to them, and help you gain control over your voices. Besides CBT, we can choose MCBT or mindfulness-based cognitive therapy, which is a type of a therapy that combines mindfulness and CBT. The last one would be medication. This treatment can be used if the voices are very troubling and you have been referred to psychiatrists. Medication may be something you need only in short term, allowing you to learn other ways of coping with the voices so that you then no longer need drugs. Okay, so those are some treatment to treatment hearing voices. For the right side will be elaborated by Leah.
Thank you, Adit. Now let's turn to the treatment of sleep problems. For sleep problems, we have three options that can be selected, same as hearing voice. You can do talking therapies and medication for your treatment. Talking therapies can help you with mental health problems that are affecting your sleep, and you might be prescribed medication for other types of sleep problems if you're not offered with sleeping pills. Besides, referral to a sleep clinic also can help you to treat sleep problems. Sleep clinics are used to assess sleep problems, which can include using equipment at home or staying overnight for an assessment. Next slide, please. Okay, so we have come to the last content that will be similarities and difference between hearing voice and sleep problems treatment. The similarities in treatment is that both hearing voice and sleep problems can be treated with talking therapies and medication. And for the difference, hearing voice can also be treated with psychotherapy, cognitive behavioral therapy, and mindfulness-based cognitive therapy, while sleep problems with sleep clinic. So that's all we have for the content.
I will return it to the moderator.
Okay, thank you, my friends. Well, that's all we have for today. Let me now summarize what we have talked about sleep problems and hearing voices. After getting an explanation about both mental health problems, now we know that sleep problems and hearing voices are not as simple as what we heard all this time. Actually, it's more complex than what we think, and of course, it's not only related to some things such as falling in love. There are many causes that cause sleep problems to occur. Based on the main point that has been explained, sleep problem is one of the mental health problems that cause someone difficulty to start sleeping. Sleep problems are caused by other things such as stress, worries, recreational drugs, and others. While hearing voices is a symptom that causes someone to hear voices in their heads. Hearing voice caused by bereavement, or bullying, stress, spiritual problems, or mental health problems such as psychosis, schizophrenia, or bipolar disorder. Treatments that can be done to reduce and overcome those two mental health problems are by talking therapies and meditation. This treatment can reduce and help us to control the problem at hand. Maybe that's all we can give for this presentation. We are very sorry if there are mistakes in pronunciation or grammatical errors, whether intentional or not. I hope this presentation can help people around us to know and understand how to treat sleep problems and hearing voices. May we always be in good health both physically and mentally. Thank you for your attention. Good morning, good afternoon, and good evening, everyone. And thank you. Wassalamualaikum warahmatullahi wabarakatuh.